Really, it's been a roller coaster for prescribers over the last 10 years. It's been a roller coaster probably for over 20 years now with opioids and what we do with them and how we use them properly. The biggest fear from the prescriber point of view is knowing what we know now is that the prescriber might be contributing to the development of misuse, abuse, or a use disorder. And of course, the biggest concern is overdose death. So that fear is important, but we are seeing that that fear is swinging the pendulum from liberal opioid prescribing, where we can't be, all the way over to no opioid prescribing, where we also can't be. So we do have to work on a happy medium as prescribers. And what the last decade has shown us is there are a lot of opioid sparing strategies. So ways that we can use things that are not opioids to have significant quality pain management. And it has also provided us the respect for the opioid and the appropriate role the opioid plays in pain management. We do not want prescribers to have significant legislative barriers to prescribing, because we want prescribers to feel empowered to use their medical knowledge, all of the schooling and education. But of course, in that comes education about opioids and what we know in 2021 about them. So we want prescribers to be able to function, but we also need to disseminate best practice to them. And we need to have them educate their patients on judicious opioid prescribing. So the past decade has afforded us different algorithms and professional societies putting out guidelines on what we should or should not be doing when we're talking about pain. And it has also, again, provided us a lot of insight into what happens in the brain when you use an opioid. The opioid for medical purposes is very important. It masks all sorts of pain, which if you have to go in and have a large surgery or you're involved in a traumatic accident and there's significant injuries that you're suffering from, we need to mask that pain. We don't want you suffering. So if we pull those opioids, are we contributing to more suffering? But when we think about the respect of the opioid, we really just need to learn from prior medications. For example, insulin. So insulin was developed about 100 years ago. And when insulin first hit the market, there were deaths, a lot of deaths associated with insulin because it's very potent and it's very dangerous. So that's similar to opioids in 2021. They're very potent and they're potentially dangerous, but it doesn't mean we should run away from them, because we can't run away from insulin. Look at where we are now. Millions of lives are saved because we use insulin. And there's going to be a lot of suffering that people don't have to go through when we use opioids, but it's to understand that they are very potent, what they do in the brain, and really the small niche that they should exist in. So it's difficult for prescribers to navigate all of this, and events like this, organizations putting out guidance, professional societies providing an overview of the literature. This is all important because in all of our busy lives, keeping up to date on best practice in our field can be difficult. But if we subscribe to these types of discussions or we're affiliated with professional societies, it's really important for those societies to see the best practice, look at that research, and push it out to membership. That way, the whole house of medicine is on the same page. And of course, there will always be a spectrum of personalities in medicine, just like in every other field of work, where there are some folks that don't care about evidence. That's a problem. But we need the majority of prescribers to appreciate opioids are important. We must respect them. There's a lot we can do before we get there. And then also lastly, what about the best opioid to use? So we're doing some research right now about likability, and the opioid is very potent. The opioid has a lot of euphoria associated with it. That's why it works. But maybe some opioids have less euphoria. Some opioids are less likable, but just as effective. And really what I'm talking about here is morphine versus oxycodone. So lots of evidence, lots of really compelling data that is going to help shape the way we treat patients. But the roller coaster continues, and hopefully over the next decade, we discover better ways to treat pain. But we've come a long way, and I'm really excited that the House of Medicine is putting a lot of focus on this, because we need to dig ourselves out of this rut, and we need to do better.